All right, as vaccinations start to roll out across the country, you probably have a lot of questions. So today, we're happy that we're going to have some answers on that and also some encouraging news on brain health.
Yeah, and we've got just the person, NBC's medical contributor, Dr. Natalie Azar, who just got her second shot of the vaccine yesterday. Hi, Natalie.
Azar, you know what? First of all, we're happy you got both doses. And I guess a lot of folks in this moment, I was just thinking, most people right now are desperate. They are literally getting on websites, calling their doctors, going to urgent cares, trying to figure out how they can get a vaccine. And I'm talking about people who are eligible today. Do you, and I don't know if this is your lane of expertise, but how can people figure out what they should do?
So this won't surprise you at all for me to tell you that there is definitely not a universal answer to this question, because primarily we have 50 states who are all doing it 50 different ways. And even beyond that, many states have, decentralized this control to the local level. So depending on where you live and where you fall on the priority list will largely determine when and where you can get your vaccine. But then in addition to that, there's supply and distribution issues. What I've been telling my patients is this: definitely reach out to your State Department of Health website, because that is at least where you can find out where, a convention center might be open for you, or campuses that are being converted to administration sites. It just kind of gives you a big picture of where you might be able to go. If you're a teacher, contact your teachers union. You can certainly reach out to your employer. And when it comes to being a patient, I think there's also a difference if you're a patient of a doctor who's associated or affiliated with a large hospital, or if your doctor is in a small rural community. But certainly you can reach out to your healthcare provider as sort of like a first pass, because it's likely that we have some information, although maybe not all the information that you want right now, because we don't even know.
So, Dr. Natalie, when, for Hoda and I, when do you think we will get our vaccinations? When do you think the majority of the country will be vaccinated?
Well, I would love to give you sort of a ballpark, and I'm going to kind of use Dr. Fauci's estimates as mine.
Yeah.
He's thinking that by April, the vaccine should should be available for anyone in the country who wants one. That might be a little bit ambitious, given how we're hearing about one hiccup after another in terms of the rollout. But I think optimistically, spring, summer is when the general population will start to be able to get vaccinated if you aren't already in one of those higher priority groups.
Yeah, you know what? Let's go on to another headline, because I think this is important too. We're talking about brain health and how it's connected to exercise. And I've heard people in the Alzheimer's space talking about this for a long, long time, but there's some new research out there that shows what's good for your body is also good for your brain. Yeah.
Absolutely. This was what I liked a lot about this study, was that it looked at individuals in their middle age. The average age of these study participants was 53, and they followed them for 25 years. And what they did at the end of the 25 years is that they performed brain scans on them to look at areas of brain damage or changes that could be correlated with your cognitive health. And what they found is that people who engaged in regular, moderate to vigorous physical activity, at least an hour and 15 minutes to 2.5 hours per week, were less likely to show those changes on a brain scan. So what's the different definition of moderate exercise? It's exercise that you can engage in but still maintain a conversation with someone. So a brisk walk or a bike ride. Vigorous activity, on the other hand, is when you're working so hard that you can't sustain a conversation. And again, to me, the take home is, even if you're 60 years old or 58 years old or something like that, get up and start moving. It's not too late. It can make a difference in your brain health.
Yeah, that's such good advice. And finally, Dr. Azar, there's one study that found a sharp decrease in cancer screenings and diagnosis in the first peak of COVID-19, which is no surprise, because people were afraid to go to the doctor.
And they're afraid now, quite frankly.
Yeah. So what are the implications? So what are those implications?
Yeah, I mean, not only were people afraid to go to the doctor, many people lost their jobs and didn't have insurance. I mean, there's numerous reasons why this happened. But yeah, so researchers at Dana-Farber analyzed how many people went for cancer screenings during the months of March and June. They found that about 25% of people went for their screenings as opposed to the same time a year before. And they calculated that close to 2,000 diagnoses of cancer or precancer were probably missed because people didn't go. And of course, I don't need to state the obvious that the earlier your cancer is diagnosed, the better off you are. So, I've had people reach out, patients and people on, Instagram have reached out and said, I'm scheduled for an MRI next week and I'm in a high, area of transmission. What should I do? My answer is always this. If it's something that has to do with, it's a breast MRI for screening or it's some sort of, prevention like that or cancer screening, you do everything you can to keep that appointment. If it's something like, my knee's been hurting, that kind of thing can wait, but don't put off cancer screening to the best of your ability to do so. It could make a difference really in life or death.
Yeah, you do wonder about the next wave of stories after COVID, maybe that. All right, Dr. Azar, thank you so much. We appreciate it.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.